Hello guys, welcome back to my YouTube channel Knowledge is Power. Today I'm back with another CHO related topic. This video is very important for all the health workers working in our hospitals. The video is regarding the AEFI kit. I will describe what are the items you need to keep in the AEFI kit, and I will mainly focus how to maintain these resistors at your respected blocks and HWC. So without wasting much time, let us start our topic. AFI, it stands for Adverse Events Following Immunization. These reactions may occur after taking any kind of vaccines due to quality of the vaccines or due to the product of vaccines and some unknown causes. These reactions takes place. Generally, whenever the children they go for HWC for taking vaccines, it is very necessary that HWC or any hospitals they used to maintain this AFI kit as an emergency tool to save the life of the children. Okay, mainly in this video I will discuss how to minimize AEFI cases. Suppose it has occurred in your HWC, I will show how to minimize AEFI cases. Secondly, I will discuss what are the items are available in the AEFI kit, and thirdly I will show how to maintain AEFI register at your respected HWC. Okay, first and foremost, let us check what are the items you need to keep in the AEFI kit. Disposable syringe having 0.01 ml graduations and 26 gauge IM needle 2 sets you need to keep. Then disposable syringe you can keep 5 ml. Okay, you can keep scalp pen set 2 sets, IV drip set 1 set, cotton wool, adhesive tape 1 each. At hospital setting, oxygen support and airway intubation facility should be available, but in the HWC it is not available. Coming for the drugs, injection adrenaline 1 is to 1000 solution, 2 ampoules you should keep in the AFI kit. Injection hydrocortisone 100 milligrams, 1 vial. Then IV fluids RL and NS you can keep, as well as you can keep 5% dextrose solution and tablet paracetamol you should keep in your AFI kit. Now let us discuss about some programmatic errors, some possible adverse events that may occur after taking vaccines. Suppose the ANMs they give vaccines at improper site in the HWCs. Suppose the BCG is given subcutaneously, or suppose DPT, DT, tetanus given superficially, injection into buttocks. This may lead to some reactions. Ultimately, you can say if the injection is given at the wrong sites or in the wrong route, then the adverse reaction may occur. Local reaction or abscess may occur. It may lead to sciatic nerve damage if it is given incorrectly in different routes. Then, if the vaccine transportation and storage, the appropriate measure is not maintained during the storage of vaccine, then also the local reactions may occur and the vaccine will not be effective. Thirdly, if the contraindications are ignored in case of children, it may lead to some avoidable serious reaction. Other errors like using non-sterile injection, reusing of the disposable syringe and needle. Again, if the wrong vaccine preparation, it may all lead to some possible adverse reaction to the children. Suppose in case of non-sterile injection, if the injection are not used properly, not sterilized, if the contaminated vaccines are used, and if the diluents are not proper, again if the reusing of the same vaccine, wiping the needle with the help of swab, administering injection over clothes, all this may lead to some serious adverse reactions. Adverse reactions like infections such as local abscess at the site of injection, it may lead to sepsis, toxic shock syndrome, or death. Transmission of bloodborne infections such as hepatitis B, HIV, and hepatitis C. If the wrong vaccines are given or wrong preparations are made before giving the vaccines, it may lead to negative effect of the drug. Example, insulin may cause death, local abscess will occur, and the vaccines will not be effective. Now let us discuss some minor reactions due to vaccines. Mild vaccines Reactions are local reaction. It may cause pain, swelling, redness, fever greater than 38.5 degrees Celsius, irritability, malaise, and systemic symptoms. For this, what are the measures you can take? You can put cold cloth at the injection site. You can provide paracetamol under the supervision of the MO, or the CHOs. They can do teleconsultation for any kind of adverse reactions. Then, if the fever is greater than 38.5 degrees Celsius, give extra fluids to the children, wear cool clothing, give rapid sponging, and you can provide paracetamol. Then, if the child is having irritability, excessive cry, and malaise and systemic symptoms, you can also give him or her extra fluids and provide him paracetamol. And when you need to report these cases, in case of an abscess, you need to report immediately. You have to fill up the EFI kit register. Okay, you need to fill up the form. And at last of this video, I'll be showing how to maintain this AFI register at your HWC. Then, if the fever is more, you can report when along with the fever there are presence of other symptoms. Then, if the children is crying excessively and if any severe reactions occur rather than the usual reaction, you can refer the child and you need to report the case. After that, there are some severe reactions may occur to the child after taking the vaccines. These severe reactions are rare. These reactions are seizures, thrombocytopenia, hypotonic hyporesponsive episodes, persistent inconsolable screaming. In most cases, they are self limiting and lead no long term problems. Otherwise, some adverse reactions are anaphylactic reaction, or you can say hypersensitivity reaction after taking the vaccines. Let us know how to overcome from such reactions. The CHOs, being the leader of the HWC, being the in charge of the HWC, they must instruct the health workers regarding the AEFI cases, how it will occur and how to overcome from such reaction being occurring. First and foremost, you need to advise the ANMs who are providing vaccines or who are giving vaccines to the children. You need to advise regarding the sites. Before administering any kind of vaccines, the NM they must know the proper sites of giving injections. They must know the proper route and dose. And while giving injection, one syringe and one needle should be used. After using one needle, they must destroy the needle. After that, proper sterilization technique must be maintained. Using vaccines only with the diluents. Using the reconstituted vaccines within 4 hours. Keeping the diluents of VCG and measles vaccine separate. Do not keep needles in the rubber cap stopper of the vaccine vials. You must advise the NMs regarding this also. That you should advise that do not store other drugs or substance in the Iceland refrigerator or deep freezer. What to do even AEFI occurs in our HWC level. Being the in charge, you need to immediately inform the MO by filling the form of AEFI. In the form, you have to write all the adverse reactions that has occurred to the child, the type of vaccines you have given to the child, what are the reactions that has affect the child. Immediately, you need to fill up the form, and if possible, you need to refer the cases from the HWC to the PHC level or CHC level under the supervision of the medical officer. Or you can do teleconsultation, and after teleconsultation, you can give immediate drug that will save the life of the person before going to PHC and CHC. Now, let me show a sample format how you need to maintain the AFR register. This is a simple format. You need to make columns and you need to fill up this form, and after that you can refer the case to the nearest PHC and CHC. First and foremost, you need to make a column regarding the week number, name of the subcenter, name of vaccines that has been provided in your HWC to the children, then father's name, mother's name, then age of the child. In here you need to put the date of birth, then date of vaccination, then name of vaccine given, AEFI noted. If any AEFI symptoms are noted here, you need to write here. Okay, the adverse reactions already I have explained. You can mention the adverse reactions in this column. Then the category, whether it is serious, severe, you have to write here. Then case seen by medical officer on the insurance. If yes, then you can write here yes. If no, then no. Then entered in the case reporting form. So if it is written, then you can write yes. If not, then no. So this is a simple format. So in the week number C, we have to mention the week and name of the subcenter, then the vaccine. Suppose the children who came in my HWC, he took penta third dose. Mother's or father's name you have to write here. Suppose my client's father name is Jyotish Salo, you need to put here. Then age of the child. So the date of birth is 1st November 2022. Then the time date of vaccination. The child took the third penta dose on the date 27 February 2023. Then the vaccine name penta third dose you have to write here. Since my child, he didn't have any reactions, so I have put here nil. Then suppose in my case I have found some mild symptoms or some adverse reactions, I need to identify the type of AEFI I have found, whether it is severe, mild cases, or moderate or very severe. I have to find out and I have to mention here mild, moderate, severe, very severe. Then again I will check whether these cases has been checked by MO or CHO. Then I have to write accordingly. If yes, then yes. If no, then no. Then whether this case has been been noted in the reporting form, you have to mention here. So this is the way how you need to maintain AEFI register in your HWC. After that, after completion of this form, you can send the cases to the nearest PHC and CHC for further treatment. Hope you all guys got brief idea how to maintain AEFI register at your HWC. Also you have learned how to maintain this kit at your HWC. Okay. Also you have learned how to minimize AEFI cases at your HWC itself. Okay. Generally the cases you can't manage at the HWC. You need to refer the cases immediately as soon as it is possible if the condition is serious. Okay, so thank you and keep learning and subscribing my channel and do share among your CHO friends.